This morning there are new concerns about the so-called twindemic. That's the upcoming flu season paired with the high COVID-19 cases we're seeing right now.
That's right. So combined, they could put even more stress on our already strained hospitals and staff. Karen joins us in studio with what people need to know to protect families as this season approaches. Good morning.
Good morning. Well, you know what doctors say the best thing that families can do is to get both the vaccines, the COVID-19 vaccine and the flu vaccine, along with wearing masks. They say by doing so, it can potentially help prevent any additional stress on the healthcare system. So doctors have already reported seeing an unusual amount of RSV cases and say that could be an indicator for what's to come this fall and winter. Now remember, RSV is that respiratory virus often causing mild cold-like symptoms. It can be serious, especially for infants and older adults. And right now, the state is averaging about 750 flu tests a day. Of those, about 14 came back positive. That's about a 2% positivity rate. Now, COVID cases are currently at 11% positivity rate. And since COVID and flu symptoms are so similar, the challenge, many say, will be knowing the difference between the two.
We have rapid tests for both. We have, tests that take a couple days to process for both. And so we'll start to see both kinds of tests being more common during the flu season this year in order to rule out one or the other disease.
Now, experts say it is possible to contract both viruses at the same time, but it is highly unlikely. Now, health leaders, Julie and Carlos, they recommend getting, of course, both of these vaccines. And they say if you begin experiencing any kind of cold symptoms, especially that shortness of breath, then you should definitely get tested for COVID.
All right. Thank you, Karen.
All right.
Well, the CDC now recommends you get a COVID-19 vaccine and other vaccines at the same visit. You no longer need to wait 14 days between vaccinations. That is a big thing right there. Now, here's a reminder about booster shots. Dr. Anthony Fauci says it looks like only the Pfizer vaccine will be available for third doses by September 20th. That's the date the Biden administration approved the rollout. Both Pfizer and Moderna are waiting for public approval from the public health officials. And though it's likely the decision on Moderna will not be happening soon, it's going to be delayed. Plans for Johnson & Johnson's booster have not been announced as of yet. You can follow along with the updates online. Just go to WTHR.com/coronavirus.